My name is Deb Jenkins. My middle initial is J, which I find to be very important. I was diagnosed in 1993 with malignant neoplasm breast cancer of the right breast. In 1993, I was taking a bath and I noticed that just in positioning in the bathtub that I felt a lump. It felt sort of deep because it wasn't on the top surface. And ironically, I just had a mammogram and had the results come back and they were fine. So I had a lumpectomy done, and then that was followed with radiation and chemo. The nurses were just amazing and wonderful. I don't know how they do it. I don't know if we as nurses or if they as nurses know that, but the community that I hang around with and the people that have had to come in for treatments or whatever to Roger Maris love the nurses. And boy, that's a big thing. Because it could be the other, they could be complaining, but no, they don't. Coming to see him, and he was very personable, just easy to talk to, walking through the door knowing that you're going to be listened to and heard, and someone's going to actually try to answer those questions, follow through with what you need, and of course the nurses, his nurses, being also mindset the same, and knowing when he's talking to you, he's listening. And that makes a difference. We are fortunate to have Roger Maris, very fortunate here in the city. And for me, I can't imagine that I would have had to go anywhere else. A person doesn't think it's ever going to happen to them no matter what it's about. And then it does. And then you're like, oh, I should have, could have, would have. You should, one, be a donor as far as on your, anything to help. You should give, you should support, you should volunteer. It could be you. If I could describe Roger Maris in one word, I would say grateful.